So now what we want to do is a form of combined PPIVMs. When you're doing your combined PPIVMs, what you're going to do is when you're mobilizing, the last part of the HRI is what you do. Meaning, for an H, I'll take up all the side bending and then I can do my flexion or extension PPIVM. For an I take all up my extension and then I do a side bending PPIVM. So it's that last part is what you're doing with your PPIVM. So in order to get him in a decent position, and if I was going to do an H, which I'm going to take up the side bending first, if I'm going to take up side bending to his left, I will pull down on this leg because that's going to create side bending. Because when I pull down on the bottom leg, it pulls the pelvis in a way that creates that ipsilateral side bending. And I'm going to take the arm and I'm going to pull it up this way, creating side bending. We'll explain that in a little bit when we do the locking. Once all the side bending's taken up, I can do my PPIVMs into extension or into flexion to see if the restriction that I felt in the combined motion in standing equaled what I feel in non-weight bearing. So weight bearing versus non-weight bearing. Now I'll have you unwind again. For the I, that's a little bit easier because we can bring him to end range extension and then I can use the pelvis to do the side bending. Or I can side bend away by bringing the pelvis the other side. Or I bring him into flexion and I can either move the pelvis again, or sometimes it's easier just to move the legs in the flexion PPIVM, or coming down. So you're, again, using your PPIVMs to confirm the segment that you think is either painful and restricted, or painless and hypomobile, and you're looking for either a consistent pattern or inconsistent pattern.